Hi, my name is Dr. David Naylor, and I've been in private practice in Burlington, North Carolina since 1978. I consult with over 1,000 doctors around the country, and I'm the founder of Naylor Clinic of Chiropractic and Acupuncture, and the websites thenaylorclinic.com and askdrnaylor.com. Are you tired of running from doctor to doctor only to play Russian roulette with different medications? Here, try this drug, that didn't work. Try this one. It seems like they're coming out with a new medication every month, only to see it fail. Are you tired of taking drugs that don't fix the problem? Do you continue to struggle with constant pain day in and day out? I'm here to tell you that there is new hope. To see video testimonials of some of the patients that we and other doctors in our program have helped get relief from chronic conditions, visit the website at lifechangingcare.com and askdrnaylor.com. What makes us different from any other doctor you've seen? Well, we treat you metabolically and neurologically. You're watching this video because you or someone you love is suffering from a chronic disease that you've been told there's no cure for. I'm here to tell you that no stone is left unturned to determine the exact cause of your chronic disease. I'll guarantee you that no one has told you what I'm about to tell you. I'm going to address what makes my program unique and how I successfully treat chronic conditions. And just how do I do that? Well, we use specific metabolic and neurological protocols. The metabolic treatments are based on specific lab panels. By using specific blood tests such as a thyroid panel, a complete metabolic panel, a lipid panel, and a CBC with autodifferential. We can assess your thyroid, adrenal glands, liver, kidneys, red and white blood cells, and gut function with the above lab tests. All can be effective with chronic health conditions. By addressing any problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you heal faster. The CMP allows us to check your blood glucose levels since glucose and oxygen are needed by the brain to function properly. Sensitivity testing is performed to determine if you have a sensitivity to gluten, wheat, rye, oats, barley, milk, eggs, yeast, and soy. If you're sensitive to any of these food groups, it could be making your condition worse, as it will increase inflammation in your brain and throughout your body. Here are some specific symptoms of these sensitivities: chronic fatigue or pain, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers or sores, vomit often, autism or hyperactivity in children. The only way to find out if you're suffering from any of these sensitivities is to run the test. The four priorities we'll look for are anemia, blood sugar and adrenal stress, GI and liver, and fatty acid metabolism. We test the adrenal glands with a test called Adrenal Stress Index. This is a salivary test, much like DNA testing. The adrenal glands sit right above the kidneys, and they're your stress organs, meaning they react to stress. If a patient has been or currently under stress, this test is a must. And if you suffer from insomnia or blood sugar issues, this test is a must. It'll measure your cortisol levels. When your body's cortisol levels are abnormal, you'll suffer from insomnia and problems with blood sugar. Cortisol levels can be corrected by specific nutritional protocols. The immune panels are extremely important. And as you know, autoimmune disorders is where your immune system attacks a particular area of your body. It might be your nervous system, joints, connective tissue, your thyroid, or all those. So we test the specific antibodies to determine if you suffer from an autoimmune condition. The immune panels consist of T and B lymphocyte subpopulation, cytokine panels IL-2, TNF-alpha, IL-4, and IL-10, and natural killer cell activity. There are two parts to the immune system: the Th1 or T cells and the Th2 or B cells. IL-2 and TNF-alpha equals the Th1. The Th1 cells are the army that kill the bad guys. They attack and clean up afterwards. The helper T cells, the suppressor T cells, the natural killer cells, and the regulatory T cells and macrophages. The IL-4 and IL-10 equals the Th2 B cells. The B cells make antibodies, and they tell the T cells what to kill. If the testing comes back with a high B cell count, the patient is Th2 dominant. And now an imbalance between Th1 and Th2 is the root of autoimmune disease. You want to determine if there's an active antigen or a dysregulation problem. Active antigens are parasites, bacteria, virus, mold, yeast, fungi, protozoan, foods, chemicals, and heavy metals. The best indicator for an active antigen as the cause of the patient's abnormal dominance is the helper-suppressor ratio on the T and B cell panel, also called the CD4-CD8 ratio. The closer to 2.5 the ratio is, or if above that, the more likely it is that you're dealing with an antigen. If the ratio is below 1.2, you're most likely dealing with a dysregulation problem. The immune panels give me an in-depth picture as to what is exactly happening with your immune system. If you're suffering from an autoimmune disorder, it obviously trumps everything, and it must be the first thing that we address. We run a test for H. pylori bacteria to determine any problems related to gut function. Intestinal permeability is used to determine if the patient suffers from leaky gut syndrome. Leaky gut describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or infection that can lead to increased permeability of the gut wall to toxins, microbes, undigested food, waste, or larger than macromolecules. It's been proposed that these substances affect the body directly, while others postulate an immune reaction to these substances. We test decreased brain neurotransmitters. Neurotransmitters are vital for brain function. Decreases in neurotransmitters can cause increased pain. We check hormone panels to determine if the patient suffers from a low testosterone in males or low estrogen and progesterone levels in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. Finally, we may need to test for inflammation in your system by testing homocysteine levels and C-reactive protein. Many patients suffer from chronic health conditions, suffer from inflammatory processes, and just about every fibromyalgia patient that I've ever treated suffers from some form of chronic inflammatory process. We use glutathione in our treatment of all chronic conditions, along with other nutritional protocols. Glutathione is the motherlode of antioxidants. Glutathione cannot be taken orally in pill form as the body will not absorb it. We've seen miraculous changes in our patient population as a result of our specific glutathione protocols. Glutathione is especially helpful with autoimmune diseases. The specific neurological testing and treatments that we perform include oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. By using oxygen, we'll help you heal faster. By using exercise with oxygen therapy, we can increase firing to the brain. By increasing firing to the brain, we help many chronic conditions. We use specific brain-based therapy, such as vibration therapy. Vibration fires the back part of the brain called the cerebellum. One of the functions of the cerebellum is to control of the spinal muscles. We may also use auditory, visual, olfactory, and caloric stimulation to increase firing of the brain. We use the Vector Genesis Class 3 laser in our office and the Zirconia laser. Laser therapy helps heal tissues and gets you better faster by increasing oxygen in the cells. Acupuncture is an ancient healing art that's been used for thousands of years for acute and chronic pain. We use needle and non-needle methods of acupuncture. And we use non-surgical spinal decompression in a computerized manner to create a negative disc pressure and help to remove pressure off the nerve. It also provides a slow stretch of the muscles which fires up the posterior column of the spinal cord to increase firing of the brain. Once we've run the necessary tests to determine your specific condition, we can successfully treat you via proper neurological and all-natural nutritional protocols. Ask yourself the following questions. How has your chronic conditions affected your job, your relationships, your finances, your family, or your other activities? What's it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 3 years if this condition is not taken care of soon? And what's it really worth to you if you could improve your condition? Finally, share this information with a family member or friend. If you're really serious about the possibility that there could be an alternative treatment for you or a loved one, call our office at 336-229-4226 and tell the staff person that you're interested in setting up a consultation case review with Dr. Naylor. On this visit, I'll consult with you and review all your previous lab reports, x-rays, MRIs, and other medical procedures. When you return for your second visit, I'll give you a report of findings, telling you if I can help you and if I'll accept your case. This offer is only good for 1 week. After 1 week, the charge for the case review is $450. Your spouse or significant other must be present at both of these visits. I'm offering you a gift of this consultation visit to see if you're a candidate for care in my office. This offer is only good for a short time, and I do not accept all cases, only those cases that I truly feel I can help. I'm looking for patients that are warriors. They'll do whatever it takes to get better. I only want you to call if you're serious about getting better, and I will not accept you in this program if you're not serious. I've studied with Dr. Michael Johnson, a board-certified chiropractic neurologist in Appleton, Wisconsin. Out of 70,000 chiropractors nationwide, Dr. Johnson is one of only 800 board-certified chiropractic neurologists. He's the author of the alternative medicine bestseller, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. Dr. Johnson consults with over 1,000 chiropractors nationwide, in which he teaches them the above protocols we've talked about. You can see testimonials of success with chronic conditions at lifechangingcare.com. Over the past 32 years, I've treated successfully over 11,000 patients. Will you be my next success story? If you'd like to schedule your consultation case review visit, call 336-229-4226 and speak with my staff. We've seen patients in our office with the following conditions: herniated and bulging disc, spinal stenosis, failed back surgery including spinal hardware implants, peripheral neuropathy, fibromyalgia, chronic fatigue, migraine headaches, dizziness and balance problems, insomnia, rheumatoid arthritis, lupus, which affects skin, joints, kidneys, and other organs, scleroderma, which affects connective tissue, Hashimoto's, which affects the thyroid, cerebral palsy, Graves' disease, the hyperthyroid, multiple sclerosis affecting the brain and spinal cord, celiac disease, Addison's affecting the adrenal gland, pernicious anemia, myasthenia gravis, which affects the muscles, dermatomyositis, which affects skin and muscles, restless legs, type 1 and 2 diabetes. I want you to know that we treat the patient. We don't treat a diagnosis. It doesn't matter to me what you come in with. I'm going to treat the whole person as opposed to treating your diagnosis. We're going to sit down and listen to you, and then we're going to set up appropriate therapy to take care of you. Now, are you a candidate for these treatments? Not all patients will be accepted into our program, and I'll make a determination of treatment acceptance after initial evaluation. Call 336-229-4226 or visit thenaylorclinic.com to set up your evaluation to find out if you're a candidate for our care. It will change your life.